Meet Tara. She's a patient receiving a heart catheterization just like you. She's here to help you understand how to prepare and what to expect for your upcoming catheterization. So, what is a heart catheterization and why is it performed? Cardiac catheterization is a procedure done to evaluate your heart by inserting a small catheter into a large blood vessel that leads to the heart and using X-ray images to visualize the arteries, heart valves, and chambers. There are three major reasons for your doctor to decide it is medically necessary to perform a cardiac catheterization: an attempt to understand how your heart is working, or why you're having chest pain, for example. One is to perform a coronary angiography with or without stent placement. Two is to visualize your heart chambers and valves. And three, to measure pressures in different areas of your heart. Coronary angiography is commonly performed during a cardiac catheterization. Your cardiologist will inject dye into a catheter to visualize the arteries in the heart and check for any narrowing or blockages that could potentially be serious and require stenting. An example of what your cardiologist is able to see is shown in this video. If your cardiologist finds a narrow or blocked artery during your coronary angiogram, a stent will be placed to open the artery and restore adequate blood flow to your heart. Sometimes a cardiac catheterization is done without coronary angiography. Your cardiologist will take measurements of different pressures in different chambers of the heart and look for problems within the heart chambers and valves. These measurements provide valuable information about how your heart is functioning and provide data that aids in the diagnosis of different heart conditions. Now that you understand why a cardiac catheterization is done, let's continue to explain how it is performed and get you ready for your procedure. Before your procedure, your doctor will review with you what to expect, as well as the risks and benefits of the procedure. Be sure to inform your doctor of all prescription and non-prescription medications that you are taking, including herbal supplements. Make sure your doctor is aware of all food and drug allergies, especially to contrast or iodine products. Adverse events do occur, even with steps to prevent them. It is important to monitor for a heart attack, stroke, kidney damage, and even death during and after the procedure. Complications include trauma to the arteries, veins, and nerves, infection, bleeding, allergic reactions, and shock, as well as thrombosis or embolism leading to a stroke or heart attack. And some cases may require emergency surgical intervention and/or cardiopulmonary resuscitation. While problems happening during and after a cardiac catheterization are uncommon, they do occur. Any concerns regarding the risks associated with the procedure should be discussed with your physician. It is advised that you stop eating and drinking 6 to 8 hours prior to your procedure, and commonly physicians ask that you abstain from eating after midnight before your catheterization. Continue taking your medications as prescribed unless directed by a physician, and don't forget to arrange for day of transportation. You'll need a ride home. You may be provided with an antibacterial soap called chlorhexidine scrub to bathe with from the neck down, with instructions to bathe the night before and morning of surgery. Some institutions provide chlorhexidine cloth wipes for bathing to help reduce the risk of surgical site infections. On the day of a catheterization, there will be a team of doctors, nurses, and technicians that will help you throughout the procedure. Prior to starting the procedure, an intravenous catheter, or IV, will be inserted to administer medication during your catheterization. This medication will help you feel relaxed but remain awake throughout the procedure. Once at the catheterization lab, medication will be administered to keep you comfortable. Your physician will then prepare the site by cleaning it. A small incision is made for insertion of the catheter in either your wrist or groin area. The catheter is inserted and advanced through the blood vessels to your heart while taking pictures. If coronary angiography is to be performed, dye will be injected into the catheter to better visualize components of your heart. You may feel flushed and warm, but this is a normal sensation. At this point during the procedure, your doctor will make the decision if any narrowing or blockages in your arteries require stenting. Your physician may take measurements of the pressures in your heart chambers or even take a biopsy of the tissue if medically necessary. After your cardiologist completes the procedure, the catheter is removed from your wrist or groin and direct pressure is applied to the site to avoid bleeding. You may be asked to lay flat for a few hours while being monitored in the hospital before being discharged to home. Medical staff will discuss your medications and help arrange a follow-up appointment in about 1 week. Most patients are able to walk around within 6 hours post-procedure and are discharged home the same day. Recovery time varies, but is generally less than 1 week. Your doctor will discuss activity restrictions with you for your recovery period. For the days following the catheterization, it is best to avoid straining when having a bowel movement, avoid heavy lifting, pushing, or pulling greater than 10 pounds for 5 to 7 days. Do not participate in strenuous activity 2 to 5 days postoperatively, and ask your doctor when it is safe to return to work, resume sexual activity, and drive. Call your doctor if you notice numbness, tingling, or discoloration in any of your extremities, if the area surrounding the site looks more swollen and bruised, or if the puncture site becomes warm to touch, red, swollen, or drains fluid. It is important for you to call the doctor for any concerns regarding your catheterization after the procedure. Be sure to call 911 if the puncture site swells up very fast, if there is bleeding from the puncture site that does not stop with firm pressure applied to the site, if you are having chest pain and believe you could be having a heart attack, or if you notice slurred speech, facial drooping, sudden weakness to your arms or legs and believe you could be having a stroke. Congratulations! You are now ready for your upcoming cardiac catheterization, and we look forward to seeing you on the day of your procedure.